We're continuing on with our discussion of Chapter 7. This is Part 4, Microscopic Examination of Urine Sediment, and it's used with permission from Dr. Kathy Parks. In this part of the discussion, we're going to focus on urine crystals. Most of the urine crystals observed in sediment are not clinically significant. All of them have been implicated in kidney stone formation, though. Clinically significant crystals will be seen in freshly voided urine. That's why it's so important to process and analyze urines as soon as possible. Pharmaceuticals can cause the formation of certain types of crystals. For example, patients may be taking certain drugs. Microscopic identification is critical because there are no chemical tests to detect urine crystals. There are a variety of identifying characteristics of urine crystals that will help you differentiate one from another. The first one we're going to talk about is the effect of temperature and pH. Amorphous urates form in the refrigerated acid urine and will dissolve with heat. Amorphous phosphates form in refrigerated alkaline urine. I want you to know the difference between the two so far as pH. All abnormal crystals are found in acid urine. pH, acid, alkaline, or neutral will help you in classifying crystals that you may find. The morphology, the shape and color, the solubility. Acid crystals are soluble and go into solution in an alkaline environment, and alkaline crystals will disappear if the pH becomes acid. It's very important that you use a urine standardization guide, that you report out your results as your laboratory protocols require. Crystals are observed with low and high power objectives and can be reported as few, moderate, or many per high power field. They may also be quantified by averaging the number seen in 10 different fields. Two additional identifying characteristics are polarization and birefringence. These aid in the identification of crystals. Polarization uses two polarizing filters that darken the field, and the light is reflected or transmitted through certain media so that all of the light vibrations are in a single plane. So you can see the picture on the left, the crystal is very bright, very crystal clear. Birefringence is the optical property of a material having a refractive index. If you remember, refractive kind of looks like a rainbow. And that depends on the polarization and propagation direction of the light. So if you look on the right, the crystals that polarize light will reverse the filter's effect. We're going to talk about the acid crystals, those crystals that are found in acidic urine, and these include uric acid, calcium oxalate, and amorphous urates. If you look at the line diagrams on the right, they show you the variety of shapes that these crystals can take. Uric acid crystals may appear yellow-brown as they become stained with urinary pigments. They come in many different shapes and sizes, from diamonds to barrels to rhomboid. You need to take care because sometimes they can appear in a hexagonal shape and they may resemble cystine crystals. So it's very important that you differentiate between these. The thickness of the crystal may provide the color base, therefore thin crystals may be colorless. Uric acid crystals are the most common form of crystals seen in normal urine, right along with amorphous. Uric acid crystals have little clinical significance. However, the presence of uric acid crystals and elevated serum uric acid may be seen in a condition called gout. The crystals may also be seen with high purine metabolism, acute febrile conditions, and chronic nephritis. The uric acid crystal is only pathogenic when it's found in fresh urine. The amount of uric acid crystals depends on the diet of purines and the breakdown of the nucleic acids. The crystals are usually seen as a four-sided plate, like a diamond shape. They can also be plates and form a rosette, as the photo on the left demonstrates. Uric acid is birefringent, as seen in the middle photo, and gives a play of colors when polarized. Calcium oxalate can be found in acidic as well as neutral urine. It appears as a colorless octahedral and envelope shape, and appears to have an X in the middle if it is the dihydrite form of the crystal. Calcium oxalate is labeled as an acidic crystal, but you may see it on occasion in a neutral and alkaline urine. The crystal can occur in pathologic conditions such as oxalate calculi, which are urinary stone or kidney stone formation, ethylene glycol poisoning, which is antifreeze poisoning, diabetes mellitus, and liver disease. Calcium oxalate also has a monohydrate form, and this causes the crystals to appear oval or dumbbell shaped, which can then form rosettes. These small oval shapes can sometimes be confused with RBC, so it's really important that you focus up and down. The monohydrate form, fortunately, is uncommon. Amorphous urate crystals are urate salts of sodium, potassium, magnesium, and calcium in urine in non-crystalline form. Macroscopically, the urine has a pink color, and this is due to the pigment uroerythrin attached to the surface of the granules. Microscopically, the granules appear red to yellow-brown. They may clump and resemble a cast, which we'll talk about later on, and they're soluble in alkali and dissolve in heat. Concentrated urines of an acid pH may have amorphous urates, and they do not have any clinical significance. When there's quite a bit of urates present, the urine may be amber in color and show a precipitate called brick dust. And the problem with the amorphous crystals is there can be so much of them that they can occlude or cover up microscopic elements of importance like red cells and white cells. Hippuric acid crystals may be in an acid or neutral pH. These are rare crystals and have no clinical significance. The problem is these crystals are sometimes confused with monohydrate calcium oxalate and small triple phosphate. Sodium urate crystals are an uncommon form of urine crystals and do not have any clinical significance and are rarely seen. If they are present in the urine, they may appear as colorless or yellowish needles in sheaths or clusters. Calcium sulfate crystals are long, thin, needle-like crystals. They appear similar to calcium phosphates. This is where the pH is important to note because this will differentiate between the two. These crystals are also very rare and they have no clinical significance. Now we'll talk about alkaline crystals, and these are crystals that are present in urines that have a pH of greater than 7. There's a variety of different phosphate crystals. There's calcium carbonate and ammonium biurate. And again, if you look at the right-hand side, these crystals can come in a variety of size, shapes, and forms. The amorphous phosphates are in urines with a pH greater than 7.0. These crystals cannot be distinguished from amorphous urates. They can only be differentiated by the pH. The phosphates may lack color and can be seen as a white precipitate, especially after refrigeration. And these are sometimes hard to differentiate from bacteria. They don't have any clinical significance, and again, if they're present in large quantities, it may be difficult to see other formed elements that may be present. Triple phosphate crystals are composed of ammonium, magnesium phosphate, and are very interesting and distinguishable in urine. They're present in neutral and alkaline urines. They appear as colorless prisms with 3 to 6 sides and oblique ends. And the term that you'll hear very frequently used for them is they resemble a coffin lid. They do polarize light, which you can see on the bottom picture, and they may form urinary calculi. They may form kidney stones. It can cause problems and be seen in chronic pyelitis, chronic cystitis, and patients with enlarged prostates. Calcium phosphate crystals, these are not usually seen in normal alkaline urine. They appear as slender prisms and are single or in rosettes. You might see them along with triple phosphate crystals, and again, these have no clinical significance. This is another crystal that is uncommon in the normal urine of an alkaline pH. These are calcium carbonate. They are small with no color and may be dumbbell or spherical in shape. Sometimes they are mistaken for amorphous phosphates. The crystal may also be similar to calcium oxalate dumbbell forms. Ammonium biurate crystals are common in old specimens, and they're caused by urea-splitting bacteria. They're normal only if they're found in freshly voided urine. They appear to be yellow-brown spherical bodies with long, irregular spicules, and you'll hear a very common term for them as thornapple or medusa head. Here are some references if you would like to go deeper. As always, write down your questions, read your book, perhaps listen to the presentation again, and if your questions are not answered, bring them to your instructor's attention.